Good morning. My name is Katie Shuck, and today I'll be presenting on behalf of the Master's students from East Tennessee State University. The title of our presentation is TennCare Cuts and the Tennessee Association Enhanced Coverage Fee. TennCare, which currently serves 1.2 million Tennesseans, is being threatened with over $200 million in cuts. Taking into account federal matching dollars, the overall loss will be $659 million. This will financially devastate patients, hospitals, and healthcare providers. The Tennessee Hospital Association's enhanced coverage fee will allow hospitals to raise over $200 million on their own. Combining the federal matching dollars to this amount, the TennCare program will recover from the deficit that it now faces. In addition, other proposed changes eliminate or severely limit coverage for both inpatient care and outpatient diagnostic and therapeutic treatment. The proposed cuts will affect the quality of life for over 1.2 million Tennesseans. As you can see from these numbers, one of the cuts affects over 50,000 people. Thousands of others will be affected by the limitations placed on X-ray tests, ER visits, any rehabilitative therapy, and any inpatient care. The cuts will also affect hospital employees who are at risk of losing their jobs. Tennessee accounts for 7% of the nation's total number of rural health providers. 35% of Tennesseans live in rural areas, and 20% live in areas where there is a shortage of health care. One of the cuts specifically targets sole rural community providers. The proposed change will require these providers to reassess every service, meaning that some people with more serious medical conditions may not be able to receive the treatment that they need. Proposed cuts will increase emergency room visits, resulting in higher costs incurred to the state. Cuts could result in hospital closures due to the uncompensated care they are providing because patients are no longer able to pay. Despite these limitations, the proposed cuts appear appealing on the economic level. The cuts will help offset the $1 billion shortfall for the 2011 fiscal year budget. The cuts could also prevent the current abuse and misuse of the TennCare program. The question is, will the potential human cost outweigh the benefits? Our recommendations to remedy this important current issue include the passage of the enhanced coverage fee, which is a 3.5% fee on hospital revenue. This fee would restore TennCare funds, thus reinstating the matching federal funds. The patients see no increase in their medical bills due to this fee. Another recommendation we offer is to base the provision of care on patient-specific diagnoses, because we recognize that not all patients require the same level of care. As social workers and social work students, we adhere to the NASW core values, and we strongly believe the proposed TennCare cuts do not abide by any of these. Taking into consideration the value of dignity and the worth of the person, we feel these cuts strip each person's right to make decisions concerning their health and well-being. As a result, each person's sense of self-worth is greatly diminished. Furthermore, we cannot accept the proposed cuts as they stand due to the negative impact on our client population. These cuts are affecting the people who most need the care. The integrity instilled within us drives us to advocate for this population. In closing, adequate health care is a basic human right and should not be seen as a privilege. If the TennCare cuts must take place, we urge the passage of the enhanced coverage fee in order to protect Tennessee's most